I
Mhm.
started looking at business coaching. I was definitely interested in going out of network. And
Mhm.
you had a free course for PTs on Embodia, and you kind of laid it out simple. This is possible. In working together, we've learned that I can be really creative, right? I'm a
Mhm.
creative person.
You
That's
are.
one of the reasons why I was able to transition my practice to telehealth. I have many years of experience in brick and mortar clinics. First, I started off as an orthopedic resident, and then
Mhm.
I was a clinic director, and I grew a startup clinic. So I didn't think I could do telehealth or do
Mhm.
virtual, but I learned how to do it,
Mhm.
right? What's the reason why I can't be creative in helping meet the needs of my patients and helping reach patients who need me without becoming an insurance-based clinician?
Yeah, I love this. And tell everyone how many active patients you have now.
So I started with two, and I now have 23 active patients on my
Yay!
caseload.
Huge congrats. And how does that feel?
It feels really good at this point when I get a free consult on my schedule. I'm so confident in that what I give and what I can offer people is something that would be valuable to them. I never dread those calls. I love those calls. And you've taught me how to be open to them. And really, it's been almost like 100% conversion rate with meeting with patients and then figuring out how to make it work because I'm very flexible with what I do with care plans with patients. I really struggled with the idea of coming onto Instagram as a consumer, as a user. I have been resistant to it, right, to social
Mhm.
media in general. But I actually have gotten some really good connections from Instagram, not just from the client perspective, but
Mhm.
also other practitioners who work in my niche,
Mhm.
who are in adjacent fields. And so being able to connect with them has been just amazing. And I'm really glad that I worked through that discomfort and initial resistance to come onto
Mhm.
Instagram. You have really helped me see that being online or saying stuff online, it doesn't have to be like a detriment to their life and health. It could actually be something that helps them gain a sense of belonging or feel seen by a provider like me, right? I don't think that there are enough physical therapists, providers out there talking about the needs and the ways that we need to accommodate people who live with energy limits. So coming online is almost like a responsibility. And so that has really, really helped me. And
Yeah.
you taught me how to repurpose content. And so I took that article that I wrote on LinkedIn and I said, you know what? I can do a couple of little tweaks and repost it on Substack as my first Substack.
Mhm.
And then there it was. So,
Yeah, I love that.
yeah, I'm so grateful that I took the leap. I would say about you and your program is to take your time to meet with and get a good vibe and a good feel for a business coach. And for me, it was within that time of me meeting you, I knew, right? I was very centered, very grounded when I met with you. And I went, oh, yeah, this is it, right? And
Uh-huh.
so I think yes, be open and meet with people, but chances are if you're listening to Allison's podcast that you're already getting that kind of sense that she's somebody that can help you, and it's just been great, and I'm just so grateful for you
Oh,
and your business.